Hello, and welcome to the webinar, What is a Multi-Level Prevention System? This is one of 11 webinars developed by the National Center on Response to Intervention, and this webinar provides an overview of the primary, secondary, and tertiary levels of the multi-level prevention system. My name is Jenny Scala, and I am a technical assistance provider for the National Center, and in addition, I have worked on looking at the implementation of response to intervention in high schools and middle schools. So the National Center has developed a series of webinars to cover information that is important for RTI implementation. And on this slide, you can see the different webinars available in the series. While you can watch the webinars in any sequence, we do recommend that you first watch the What is Screening and the What is Progress Monitoring webinars, since I will refer to these essential components throughout this presentation. Following this webinar, learn more about how the multi-level prevention systems relate to IDEA and about how to select evidence-based practices. If you have not already done so, you should print out the vocabulary handout and the Defining Three Levels handout. These handouts will be useful for your note-taking throughout the webinar. This webinar will provide an overview of the multi-level prevention system, and then will describe each of the three levels. The participant objectives for this training are as follows: understanding the multi-level prevention system and being able to describe each level, use screening and progress monitoring data to make decisions at all levels of the multi-level prevention system, including movement between levels. One helpful way to check your understanding throughout the webinar is to complete the accompanying vocabulary handout. The handout provides a table with a list of key terms on the left side with columns to the right side for you to track your understanding before and after viewing the webinar. Before viewing the webinar, you should make predictions of the meanings of each term. Then, throughout the webinar, you will complete the final meaning column based on the definitions provided, along with a picture, sketch, or example column, where you can add anything helpful for remembering what you have learned. You can see how in this example I was able to clarify the meaning of primary prevention level after watching the webinar. If you have not already made predictions for key terms on this webinar, please go ahead and pause this webinar so that you can do so now. Press play when you are ready to continue. The Defining the Three Levels handout can be used to take notes throughout the webinar about the differences between each prevention level. In the left column, you will see a list of questions. Answer these questions as you learn about each of the prevention levels. Following the webinar, you may wish to review your table to gain a deeper understanding of the similarities and differences between the levels. The National Center on Response to Intervention has developed this graphic to highlight the RTI framework. Many of you probably associate that red, green, and yellow triangle with response to intervention. In reality, though, the triangle does not represent the RTI framework. It represents only one component, the multi-level prevention system. The center graphic takes into account all of the essential components and, most importantly, uses data to make decisions, which is often absent from the traditional RTI triangle. If you look at the far left, you see screening. The far right, progress monitoring. At the bottom, the multi-level prevention system. The three outer components require and are necessary parts of the database decision-making, which is why the arrows travel in both directions. If the three other components are in place but database decision-making is absent, then RTI is technically not being implemented. In the center ring, you will see the phrase culturally responsive, meaning that screening tools, progress monitoring tools, core instruction, interventions, and database decision-making procedures should all be culturally responsive. In the same ring, you will notice the phrase evidence-based, which implies that all components are evidence-based. If these components are implemented through a cohesive model, we expect to see improved student outcomes. I will now briefly review screening, progress monitoring, and database decision-making before moving to the focus of the presentation, the multi-level prevention system. The triangle graphic depicts the progression of support across multi-level prevention system. Although discussions in the field frequently refer to tiers to designate different levels of interventions, the center actually avoids the use of this term when describing RTI framework and instead uses the term levels to refer to the three prevention foci: the primary level, the secondary level, and the tertiary level. Although the term levels is often used synonymously with the word tier, they can be different. The common denominator should always be the intensity of the support. This triangle represents 3 levels of prevention and the percentage of students we would expect to benefit from those levels of prevention in an effective system. The first, or primary level, is indicated in green. We expect most students, or at least 80% of students, to benefit from instruction, which uses well-differentiated instruction in the core curriculum. The next, or the secondary level, is indicated in yellow. We expect about 10 to 15% of students to need supplemental, small group instruction to benefit from the core instruction and curriculum. The top level is red, or the tertiary level, includes specialized, individualized instruction for students with intensive needs. It typically involves small group and or one-on-one instruction of 1 to 3 students who are significantly behind their peers. Decisions regarding student participation in both primary and tertiary level preventions are made in a case-by-case basis according to student need. Remember, the school or the local education agency model is their interpretation of the RTI framework. Schools and districts may vary widely in the number of tiers included in their framework. Regardless of the number of tiers of intervention a school or district implements, each should be classified under one of the 3 levels of prevention: primary, secondary, or tertiary. This will allow for common understanding across schools, districts, and states. Within the 3-level prevention system, schools may configure their RTI frameworks using 4, 5, or more tiers of intervention. The minimum tiers possible within a school or district's model is 3, with 1 tier representing each level of intensity. In choosing the number of tiers for the RTI model, practitioners should recognize that as the number of tiers increases, the complexity of the model also increases. In all models, all students receive instruction within primary prevention level, the core curriculum, which is often synonymous with Tier 1. When we're thinking about the interventions, though, the interventions are provided within each level and within each tier. Variations in the model, including the number of tiers and the intervention used within each tier, should be based on the needs of the population. For example, one school may have 3 interventions of approximately the same intensity in the secondary level of prevention, while another school may have 1 intervention at this level. While there are differences in the number of interventions, these schools will have a common understanding of the nature and the focus of the secondary level of prevention. Within each level of prevention and tier, there can be more than 1 intervention, but this is not a requirement. The National Center recommends different evidence standards across the different intervention levels. So on the left side of your screen, you'll see the research-based curricula. This is recommended for primary prevention across subjects. And this means that the components have been researched and have been found to generally be effective. The curriculum materials have not been rigorously evaluated, though, as a package, and that's generally what we're seeing around research-based curricula. However, if we're thinking about evidence-based interventions, this is recommended for secondary and tertiary level supports in terms of prevention. These materials are evaluated using a rigorous research design, and there is evidence of positive effect for students who receive the intervention. This will be discussed more in the presentation. First, we're going to talk about the primary prevention in more detail. So primary prevention is high-quality core instruction that meets the needs of most students. You'll see that the focus is for all students. The instruction is a district curriculum and instructional practices that are research-based, align with state or district standards, and incorporate differentiated instruction. The setting is the general or regular education classroom, and there are assessments that correlate to the primary level prevention, and you'll see those on the slide. Going more in depth, just looking at the focus, in the previous slide we talked about how the primary prevention focus was for all students, including those with disabilities, learning differences, or language barriers. You can increase access for all students through differentiated instruction, linguistically and culturally responsive practices, and using accommodations or modifications. Within the primary level instruction, all of the curriculum materials are research-based for the target population of learners. including subgroups. Procedures are also in place to monitor the fidelity of implementation of the core curriculum. The preponderance of evidence supports that the core curriculum is delivered with fidelity as it was intended to be delivered. Teaching and learning are well articulated from one grade to another and within grade levels so that students have highly similar experiences regardless of their assigned teachers. In most or all teachers differentiate instruction using students' assessment data to identify student needs, as well as school-based professional development is institutionalized and structured so that all teachers continuously examine, reflect on, and improve instructional practice. And there's more information about this in the Center's Integrity rubric. The core curriculum is a course of study deemed critical and usually mandatory for all students of a school or a school system. The core curricula are often instituted at the elementary and secondary school levels by local school boards, departments of education, or other administrative agencies charged with overseeing education. Teachers use student assessment data and knowledge of student readiness, learning preferences, language, and culture to offer students in the same class different teaching and learning strategies that address their needs. And differentiation can involve mixed instructional groupings, team teaching, peer tutoring, learning centers, and accommodations to ensure that all students have access to the instructional program. Differentiated instruction is not the same thing as providing more intensive interventions to students with learning disabilities, and that's an important thing to keep in mind. The setting for primary prevention is the general education classroom or a similar setting. Various grouping strategies such as the whole class and cooperative learning groups are used. Ongoing data drives instructional decisions in the primary prevention. This includes universal screening, which is used to determine students' current level of performance, continuous progress monitoring to confirm risk status and monitor progress of at-risk students, outcome measures or summative assessments for accountability purposes. As we've discussed in the screening and progress monitoring modules, the data collected can help inform decisions within the primary prevention level. Screening data can help identify students in need of additional assessment or instruction and can evaluate the effectiveness of the core curriculum. Progress monitoring data can be used to confirm or disconfirm students identified through screening as at risk. All students in primary prevention are screened using validated screening tools. Screening data can show you which students are falling behind their peers or below determined benchmarks and who needs additional assessment or instruction. Students scoring below a cut score are suspected of being at risk for reading or math difficulties. The image at the left, if you're looking at the screen, shows a box plot that compares an individual student to his or her peer group. The class or grade is represented in that box plot, and this level of analysis would be appropriate for identifying students in need of supplemental support. And in this example, you can see that the student is performing well below his or her peer group. The image on the right provides an example of data output using criterion scores, or criterion reference data, to identify students. In this example, based on their scores, students are categorized as established, emerging, or deficient. Using data from primary prevention, districts and schools can also analyze performance by subgroups and make decisions about the efficacy of primary prevention for most students. In this graph, the red line, or the target line, represents target scores or expected scores of students. Depending on the location, this may either be the established benchmarks, the cut scores, or nationally performance norms. This data can help us to answer questions such as, how is the general population performing in comparison to the target scores? How are students in Title I performing similar to students in the general education setting? And are students with disabilities performing at similar rates as students without? Progress monitoring data are used in primary prevention to confirm or disconfirm risk status. Suspected at-risk students are monitored for 6 to 10 weeks during primary prevention with a validated progress monitoring tool. Students with adequate slopes, such as this one, continue to receive only primary prevention. Or progress monitoring data may confirm risk status, which is this example. And this student would receive additional instruction and supports in secondary prevention in addition to the core curriculum. Next, we're going to discuss the secondary prevention level. The secondary prevention represents evidence-based interventions of moderate intensity that address the learning or behavioral challenges of most at-risk students. These are for students that have been identified through screening as at risk for poor learning outcomes. The instruction is targeted supplemental instruction delivered in small groups. And again, this also occurs in the regular education classroom or some other regular education location in the school. There are assessments that are associated with this level of support, progress monitoring, and diagnostics. The focus for secondary prevention is on students identified through the screening as at risk for poor learning outcomes. This is typically between 15 to 20% of the entire population. A school or district's target identification rate may mean that not all students who meet these selected criterion for secondary prevention receive this level of support. Schools and districts may consider two tiers within the secondary prevention if the performance levels or needs of students receiving secondary instruction vary greatly. More information about target identification rates can be located in our screening module. In an effective secondary system, the following are true. All secondary level interventions are evidence-based. Secondary level prevention is well aligned with the core instruction and incorporates foundational skills that support core instruction. Procedures are in place to monitor the fidelity of implementation of secondary level interventions, and secondary level implementation is generally implemented with fidelity according to developer guidelines. Secondary level interventions are led by well-trained staff, and the group size is optimal for the age and the needs of the students. Decisions about responsiveness to intervention are based on reliable and valid progress monitoring data that reflect the slope of improvement or the final status at the end of the secondary level prevention. Decision-making criteria are implemented accurately. Secondary level interventions supplement core instruction. More information again on this can be found in the Center's Integrity rubric. Secondary prevention typically occurs in the general or regular education classroom, or other regular education location within the school. Secondary instruction is provided in addition to the core curriculum, so students should not be pulled from general education instruction. It relies entirely on adult-led small group instruction rather than whole class instruction, and involves instruction where group size is optimal for the age and the needs of the student. Decisions about responsiveness to intervention are based on reliable and valid progress monitoring data that reflect slope of improvement or the final status at the end of the intervention period. These decision-making rules are applied accurately and consistently. Progress monitoring data and diagnostic assessments are important when developing a data-driven secondary system. These tools can be used to monitor student response to secondary instruction, evaluate the efficacy of the secondary system, and should be conducted at least monthly. Diagnostic assessments are used within a secondary prevention system to match student needs to interventions. Let's look at how these data inform decisions at the secondary level. In the progress monitoring module, we learned that progress monitoring tools and data can help us to set goals using end-of-year benchmarks or weekly growth rates. As we've discussed, the data collected within the secondary level of prevention can help determine the response to secondary interventions either through the 4-point rule or the trendline analysis. Progress monitoring data can also be used to compare the efficacy of secondary intervention. The 4-point rule states the decision is made on the last 4 data points. The 4-point rule can be used if 3 weeks of instruction have occurred and at least 6 points have been collected by examining the 4 most recent data points. The following decisions can be made. If all 4 are above the goal line, you may choose to increase the goal or to discontinue providing secondary level interventions. It is recommended that progress monitoring continue in primary prevention to ensure that the student continues to make adequate progress without the supplemental support. If all 4 are below the goal line, you need to make an instructional change. If all 4 data points are both above and below the goal line, you need to keep collecting data until the trendline rule or the 4-point rule can be applied. The second approach is trendline analysis. As you can see by these data, the trendline is steeper than the goal line. In other words, the student is showing increasing scores and making progress. Depending on how the goal was set, you may choose to increase the goal or discontinue secondary level interventions. It is recommended that progress monitoring continue in the primary prevention to ensure that the student continues to make adequate progress without supplemental support. Schools and districts can use the average progress monitoring data to determine average expected growth rates of intervention used and determine which interventions lead to greater gains. To look at this information, clearly delineated interventions must be used for an extended period of time. Secondary prevention is expected to benefit a large majority of the students who do not respond to effective primary prevention. Most students receiving secondary interventions should benefit from this instruction. A small percentage of students, however, will demonstrate inadequate response, providing evidence that they require more intense, individualized instruction. Data should also indicate that interventions and database decision rules were implemented with fidelity. And now, we will discuss the tertiary prevention levels. Tertiary prevention, or the third level of the RTI prevention framework, is the most intensive of the three levels and is individualized to target each student's areas of need. At the tertiary level, the teacher begins with a more intensive version of the intervention program used in the secondary prevention. However, the teacher does not presume it will meet the student's needs. Instead, the teacher conducts frequent progress monitoring with each student. When the progress monitoring data indicate that the student's rate of progress is unlikely to achieve the established learning goal, the teacher engages in a problem-solving process. That is, the teacher modifies the components of the intervention program and continues to employ frequent progress monitoring to evaluate which components enhance the rate of student learning. By continually monitoring and modifying, as needed, each student's program, the teacher is able to design an effective, individualized instructional program. The focus of tertiary prevention is on students who have not responded to primary or secondary level prevention and typically would be 3 to 5% of the entire population. The following are true in an effective tertiary level of prevention. Tertiary level interventions are evidence-based, standard protocols, or are based on validated methods for individualized instruction. Interventions are more intensive than secondary interventions. In other words, a standard protocol intervention may be individualized based on using ongoing progress monitoring data to make adjustments in instruction. Procedures are in place to monitor the fidelity of implementation of tertiary level interventions, and the preponderance of evidence supports fidelity. Tertiary level interventions are led by well-trained staff, and the group size is optimal for the age and the needs of students. Decisions about responsiveness to intervention are based on reliable and valid progress monitoring data that reflect the slope of improvement or the final status at the end of the tertiary level prevention. Decision-making criteria are implemented accurately. Decisions regarding student participation in both primary and tertiary levels of prevention are made on a case-by-case basis according to student need, and interventions address general education curriculum in an appropriate manner for students. Again, there's more information about this in the Center's Integrity rubric. The location of tertiary instruction is a regular education setting or other appropriate setting within the school. Decisions regarding student participation in both primary and tertiary level preventions are made on a case-by-case basis, and tertiary preventions address the general education curriculum in an appropriate manner for students. Group sizes are optimal for the ages and the needs of the students. Decisions about responsiveness to intervention are based on reliable and valid progress monitoring data that reflect the slope of improvement or the final status of the end of the intervention period. These decision-making rules are applied accurately. Within the tertiary level of prevention, weekly progress monitoring is recommended due to the number of data points needed to make a decision, although every other week should be the minimum. For students in tertiary instruction, established learning trajectories are developed, and progress monitoring data are compared to the learning trajectory to determine the degree to which a student is making adequate progress. Continuous diagnostic assessments are used to match instruction to needs and inform individualized instructional planning. In the progress monitoring module and in the secondary prevention section of this module training, we discussed two approaches to goal setting that are also appropriate for tertiary prevention. The first option is the end-of-year benchmark, and the second option is using national or local norms of improvement. A third option that can be used when local and national norms are not useful or appropriate is the intra-individual. To use this option, identify the weekly rate of improvement for the target student under baseline conditions using at least 8 CBM data points. Multiply this slope by 1.5 because we want students to not only maintain that growth but also increase it by at least half. Take the product and multiply it by the number of weeks until the end of the year. Add this product to the student's baseline score. This sum is the end of the year goal. The progress monitoring slides training module has much more information on using this method for establishing goals and goal setting. As we discussed in the progress monitoring training, the data collected within the tertiary level of prevention can help determine response to tertiary interventions through the 4-point rule, the trendline analysis, or trendline analysis with slope. Progress monitoring data can also be used to compare the efficacy of tertiary interventions. As with the secondary prevention, decisions about response to instruction at the tertiary level should be made using established written decision-making criteria. Remember, we can use the 4-point rule if 3 weeks of instruction have occurred and at least 6 data points have been collected. The following decisions can be made by looking at the 4 most recent data points. If all 4 points are above the goal line, we increase the goal or discontinue the more intensive instruction. If all 4 data points are below the goal line, we make an instructional change. If the 4 points are both above and below the goal line, we continue to collect data until the trendline rule or the 4-point rule can be applied. Think about what decisions we can make about this student's response based on the data that's on the slide in front of you. Because the last 4 points are below the goal line for the students, we would consider making an instructional change. We can also apply trendline analysis to determine the student's response to tertiary intervention. What is this student's response? In looking at the data and the graph that's on the slide, you'll see that because the student's trend line is below the goal line, again, we would consider making an instructional change. Based on this student's performance on the previous intervention, the team decided to change its intervention. On this graph, the slope of the student's trend line after the change of instruction is steeper than the slope of the goal line. As a result, we might consider raising the goal or discontinuing the more intensive instruction. Just as with secondary prevention, progress monitoring data, schools and districts can use the average progress monitoring data by intervention to determine the average expected growth rate in which interventions lead to greater gains in tertiary level and tertiary supports. Tertiary prevention is also expected to benefit the large majority of students who do not respond to effective secondary and primary prevention. The majority of students who are in tertiary prevention should demonstrate adequate progress with the additional intensive supports. If the majority of students are not benefiting from tertiary, it is difficult to determine if it is a student-related issue or program-related issue. In effective multi-level models, more students should be moving to less intensive levels of instruction than to more intensive levels. As evidenced by progress monitoring data, students who do not benefit from the interventions provided under tertiary prevention may represent a student with a disability. These data could provide useful information as part of a comprehensive evaluation when a disability is suspected. For all levels of prevention, primary, secondary, and tertiary, data should guide your decisions about changing the level of support needed for students to be successful. Changing the intensity includes both increasing and decreasing the level of and intensity of the support given to a student. In cases where students are responding to interventions, teams may consider decreasing the intensity. In cases where students are not responding or making adequate progress, the team may consider increasing the intensity. There are 5 main approaches to changing the intensity of an intervention. The first is to change or supplement the intervention itself. In cases where the current intervention is believed to be ineffective for a student, the team may consider selecting a different intervention. However, this may not always be necessary. If student data indicate a student is making some, but not necessarily adequate progress, the team may decide to change the intensity of support by manipulating one or more factors of the intervention or adding additional instructional strategies to supplement the existing intervention. Another way to address intensity is to increase or decrease the duration of the intervention, or how long the student is receiving the intervention each time. The intensity may also be changed by increasing or decreasing the number of times a student participates in the intervention or the frequency of the intervention. For example, the delivery of the intervention may increase from 3 to 5 times per week or increase the number of times per day. In some cases, the intensity may be modified by changing the interventionist. For example, some schools use paraeducators to deliver supplemental interventions. The intensity of the intervention may be changed by using a content specialist such as a reading coach to deliver the intervention. Another way to modify the intensity is to increase or decrease the number of students participating in the intervention. For example, the team may consider reducing the group size from 5 to 2 to provide students with a more direct instruction and opportunities to respond. Thank you for taking the time to listen to What is a Multi-Level Prevention System? To find more resources on this topic or to view the other webinars in the Implementer series, please visit our website at www.rti4success.org. And remember, in that URL, it is the number 4. You can also find more information from the RTI Action Network and the IDEA Partnership website.